Good morning. Thank you for joining us. I am Kelly Nerick, and many of you already know me. I am the Senior Director of Products and Services, and many of the email messages that you receive come to me about the employee benefits that SBAM offers you and your customers. Joining me today, I have Winston Larson, who is in our membership sales team. Also joining us is our CEO, Brian Callie, and Sarah Linville with Blue Cross Blue Shield of Michigan. So we have a lot to cover today. So without any further ado, I will have Winston kick us off. He's going to just review some of the advantages for you and your customers of being a member with the Small Business Association of Michigan.
Thanks, Kelly. It's a pleasure to be here, everybody. Thank you for taking the time out of your day to share some time with us, and excited to kind of go through some stuff with you. So when we talk to our members or your customers, we're looking at the value of SBAM membership kind of in the three pillars approach. So Michigan is the largest state-based small business organization in the country. And those three pillars of value that we talk about is the group purchasing power. We have right around 33,000 members. And so that allows us to do some pretty creative things in that space. So it's providing tools and resources to help your customers attract and retain talent, manage employee benefit programs, and offer discounts and reduce some of the administrative burden for deploying some of these resources as well. On the other side of it, we have networking. So we have owner-to-owner networking events. These are wonderful opportunities for small business owners to get into a room with each other, engage with one another. People who really understand what it's like to own and operate a small business. They empathize with the struggles, and they understand how huge the wins are. And these are wonderful opportunities, like I said, for business owners to get together. The last and final pillar is the advocacy pillar, and Brian will speak more to this in a little bit, but this really is just to help ensure Michigan is a great place to own and operate a small business. So Kelly, if you could move to the next slide. So when we talk about the value from the products and services standpoint, so we have a products and services committee, which is made up of our small business members, and we do our best to have a diverse group of business owners in various stages of the business and various sizes, so that we have a well-rounded product offering for things that are relevant to the small business owners here in the state of Michigan. And as I mentioned, we use that group buying power to help small businesses get a better deal than they could on their own. And again, a major component of this is in the employee benefit space. We want to make sure that small business owners are as empowered as they can be to go out into the labor market and attract and retain talent and be as competitive as they can be in that space. And then, of course, also reducing the administrative burden. As somebody in the membership department, when I'm talking to our prospective members and your potential customers, I don't want the barrier to them employing employee benefits to be that competitive in the marketplace to be an administrative choke point. We want to try to shoulder some of that burden so that this doesn't just create more headaches for the small business owner. Mm-hmm. Thanks, Kelly. Next slide. Thank you. And those owner-to-owner events that I mentioned. So it's designed exclusively for small business owners. The team here at SBAM has done a wonderful job of curating a group of people and setting the expectation that these are owners in the room. These aren't salespeople. These aren't COOs. We ask that if a business owner registers and then a scheduling conflict comes up, that they don't send a replacement, that they just try to catch us at the next event, because really the programming and the network is really intentional, and it's really driven towards the small business owner. And so we really do a really good job of requiring that the folks who are in the room have a vested interest or an ownership interest in the organization that they're representing. And so we've broken the state up into 10 different regions, and each region we host about 2 to 3 events in each year in each region. So there's lots of opportunity for that peer-to-peer interaction, We try to incorporate either a unique venue or experience to try to get maybe some behind the scenes at one of our member hosts, or just at a venue that's a really popular place to meet and congregate. And then, of course, at these events, Brian and his team will provide updates from the local legislators. We invite the local legislators to come and speak directly to our our small business owners, so that they can engage directly with the small business owners in their community, but also showcase what's on their docket, what initiatives that they're trying to bring forward, and also allow the small business owners to have that direct interaction with their local legislator. So next slide, Kelly. And I think that's it for me. Thank you again, everyone, for sharing the time. I'm going to turn it over to Brian.
All right, well, let's cover some of the advocacy work that we do for our members. The first thing I want to point out is that the Small Business Association of Michigan is an intentionally bipartisan organization. So we are very, very disciplined about operating and behaving in a bipartisan way. If you own a business, regardless of where you're at in the political spectrum, you'll feel at home at SBAM. We really do stick to business issues. The other thing is that when somebody joins SBAM, we do not assume that a person, because they joined, wants to be a part of the political system. This is one of the things you have to opt in. When you join SBAM, you're filling out your membership profile. You will then make a decision. Hey, I want to hear from SBAM about what's happening in the political world. And then when you opt in, that starts a weekly public policy newsletter update. We call it the Lansing Watchdog. And while we do look at what's happening across all levels of government, we really do focus mainly on what's happening in state policy. So you get a weekly public policy newsletter. There's also occasionally what we call a call to action, where we'll make requests. We'll put out to everybody who opts in a request to take a look at an issue that we're particularly concerned about, and ask the business owner or their team to reach out to their legislator and say, hey, here's my opinion on this issue. Really support this bill that's being considered right now, or oppose it, and here's how it would affect my business. And I'll point out that that's really the secret to the success of what we do. Everything is through the lens of small business owners. And so when a position is taken, it's communicated in a way that is in from the perspective of those that the legislators can see in their local districts. So those calls to action are very, very impactful. There are times when we'll have when we do one of those, we might have over 1,000 responses. There are not too many organizations that can generate that type of traffic into the political system. It has a huge, huge impact. We do have on the team 4 people that are registered lobbyists, which includes me, by the way. This is, while it's not the primary function that I carry at SBAM, of course, being CEO, it's something that I'm personally very, very engaged at several different levels. And then how do we determine our platform? Well, it's through task forces of small business owners. So the staff at SBAM, carries the wishes forward, or carries the positions forward that are set by small business owners and task forces, and then it goes to our board of directors for approval, and our board of directors is made up 100% of business owners. Okay, next slide. Want to just highlight one of the areas where we did a task force recently, the healthcare task force, and it had been a while since we had refreshed our policy. When we set policies that have overarching values or measuring sticks that the team at SBAM can use to go back into the system and compare to proposals. So there might be a proposal that moves forward and a new concept, maybe a new idea, but we compare that to the system of positions that our members take in determining whether we support or oppose that legislation. far and away, as we went through the process, we talked to our members, as we do surveys with our members, managing the cost of healthcare and health insurance is top of their list. And so that's why it's number one here. That most of the conversation around it really is about managing costs. So that means that when a proposal is moving its way through the system, we are thinking of we're thinking in terms of, will this proposal make providing healthcare benefits to our members more costly or less costly than, and of course, favoring the less costly side. Promoting flexibility. Our members really don't like the government getting in between the employer-employee relationship. And so the idea of having as many options as possible, fewer mandates, and that's also on this list here. And the limiting mandates is talking about mandated benefits within the health insurance code, but we also oppose mandates on exactly which benefits an employer must provide. And so really wanting to put the small business owner in the driver's seat of what their employee relationship looks like. Improving transparency and accountability into the system is also a key feature, and then encouraging competition. Think of a competition in terms of like there's a lot of consolidation in the healthcare industry and a lot of smaller players that are kind of getting squeezed out, and so we like to have a place in the delivery system of healthcare for small businesses too. All right, next and final slide is the it's just a list of some other things that we're focusing right now. I won't go through every single one of them, but I just want to highlight a few of them to share some of the things that we're working on today that we're concerned about. There is a pending Supreme Court decision, a Michigan Supreme Court decision on paid sick leave mandates, and also a pretty substantial change in Michigan's minimum wage. The overall minimum wage would go, depending on this court decision, it could go from $10 to $13, $10.33 now up to about $13 an hour, but also eliminate the tipped minimum wage system, which is something really important to the business model of most restaurants, certainly sit-down restaurants. So that could have a very big impact on the restaurant and hospitality industry, but also would affect all businesses that because it changes the paid sick leave requirements. It would require, for example, that all part-time employees have paid sick leave benefits. As one example, there's probably a dozen or so changes that we expect that that all small businesses would have to make to their leave policies if the Supreme Court decides to strike down the 2018 compromise in this area. So we're pretty involved both in the legal process itself. So we get involved in the court process for these things, and we're doing some legwork and kind of plowing the ground to get it ready in case the decision goes against the business community in this case, to try to get the legislature to make a change. And then also unemployment benefit expansion. That one's really been picking up steam, and there's about 200,000 open jobs in Michigan today. And also the trust fund is about half of what it was before the pandemic. So we don't think this is the right time. Number one, the trust fund hasn't recovered yet from the pandemic, so we shouldn't increase expenditures out of it. But also, there's just a lot of demand for people right now, and so we just think it's an odd time to be considering such a thing. But that's moving through. We've got local preemption repeal. That's another one that today, minimum wage, overtime rules, benefit mandates, all that kind of stuff is done at the state level. And so there's a proposal now that has kind of had some stops and starts over the last year that would eliminate that local preemption and make it such that you could have a patchwork of up to 1,800. Every local government around, townships and cities and counties could have their own minimum wage, their own overtime rules, their own benefit requirements, that all of these things that today are consistent across the state would be a patchwork of dozens or potentially hundreds of different regulations, depending on which local jurisdiction you happen to be in. That's just a flavor of the types of things that that we keep track of, and we keep track of these things to ensure that we know this in the real world, a small business owner just doesn't have the time to comb through legislation, so we're doing that for them. We do get involved in every single level, whether it's in the when the law is being made, when the rules are being set for how a law is implemented, and also interpretation after a law is passed in the court action. And so we're pretty sophisticated in how we operate here, and very thorough. But I want to underscore everything that we do is driven by positions that are set by actual small business owners. This is not something that we think up on our own. Our job is to carry forward the wishes of our membership, those who have the guts to start a new small business, or to start a small business, to run, to operate a small business, and to be responsible for that many people. We have all the respect in the world for that, and it inspires us every day to make sure that we get this part right. Now, we do keep updated something called the SBAM legislative watch list. And this is something that you can look at any time. You see the at the bottom there, a website address to it. What this is just the top things that we're concerned about today. So this is not the watch list of good things. This is a watch list of bad things that we're concerned about, and we'll say right in there, like, we're really concerned about this one right now, or there are others where, you know, maybe they've been kind of pushed to the back burner, but we're keeping an eye on. You can see that all in at sbam.org. So I appreciate the time and attention today, and I think that was the last slide. Is that true, Kelly?
Yeah, thank you so much, Brian. And again, our members, Brian mentioned our members, they are so passionate and so involved, and on our website, you can see some videos of testimony that our members have provided, as well as ways that you yourself can get involved. There's more information about the healthcare task force, and of course, contact information if you would like to reach out to Brian or anybody on our advocacy team. We urge you to be educated, get involved. It's such important information related to the small business climate here in Michigan. So thank you, Winston and Brian. Sarah will now share her screen for the portion for Blue Cross Blue Shield. She has some important information to share as far as our partnership with the Blues. So Sarah, please go ahead.
All right, perfect. Kelly, can you confirm that you guys can see my screen?
Yes.
Okay?
Yeah.
All right, wonderful. Thank you. So good morning, everyone. My name is Sarah Linville, and I am the manager of Chamber and Association Engagement at Blue Cross. In my role, I do work very closely with SBAM to ensure that the latest and greatest Blue Cross information is shared with the market, including our customers and our agent partners. And I'm excited to join you today to provide a bit of information regarding the Blue Cross difference, including some programs that are built into our fully insured health insurance plans, resources to help you and your customers educate their members about the various programs available to them, as well as provide an overview of some specialty benefits that we offer, including dental and vision coverage. So the first screen that I have here, many of you have likely seen if you did join any of these other agent webinars, but this document here, or this placemat, is something that Nicole Sherwood previously reviewed, and she did go through a variety of the items here. But ultimately, this document provides an overview of all of the programs and solutions that are built into our fully insured health insurance plans, address the total cost of care for members, and also focus on the whole health of our members. Like I said, Nicole reviewed a lot of the items on this document previously, but I did want to share this document again for a couple of reasons. First, I am going to review one additional item that's listed on here, and that is Blue Cross Coordinated Care Core, so our base care management program. But also, again, this document is just a really good reminder of all of the different solutions we have available and that are included in our plans. many of which are available to our members at no additional cost, such as our maternity, menopause, condition management, and cancer support solutions. So when you're having your renewal conversations this year, I just wanted to remind you to please work this information into those renewal conversations, as it is vital that both our customers and their members understand the variety of solutions available to them. Help ensure they have access to convenient, affordable care options when they need it most. I will also at the end put a link to this document in the chat so everyone has easy access to it, but it can also be found within Agent Secured Services. And again, this document is a great resource because all of the bolded pieces of information here are actually embedded links that will bring you or your customer to additional resources on each of these programs. So as I mentioned, I just wanted to highlight one additional program that was on that placemat that we didn't previously cover in these webinars, and that is Blue Cross Coordinated Care Core. Blue Cross Coordinated Care Core is a multidisciplinary and comprehensive approach to care management. It is focused on providing clinical support to high-risk members and members with complex and chronic conditions. With this program, Blue Cross places the member at the center of the multidisciplinary team, a team that works together to treat the whole person. The team includes nurse care managers, dietitians, social workers, medical directors, behavioral health specialists, pharmacists, and non-clinical support. By providing the member with access to a multidisciplinary team, a member's needs are evaluated and approached holistically from various aspects of the care continuum. This allows the member to gain a better understanding of their condition, their medications, and their treatment options. In addition, health risks can be identified and addressed. The member can be connected with additional support in their own community, and we can ensure they have access to the support they need, including behavioral health services. But most importantly, I do want to mention that this program is included in all of Blue Cross health plans, fully insured and self-funded at no additional cost to the member or the customer. I know I highlighted or I showed that placemat at the beginning, so I did want to just touch upon briefly our employee engagement toolkits that are available at bcbsm.com/engage. And I wanted to highlight this because these toolkits do provide up-to-date educational materials to help members stay informed. So these are something that agent partners can remind our customers or their customers that we have available. And then the customer has easy access to resources to help communicate programs and solutions to their members. This really helps to ensure that our employers are getting the most out of their investment in their employees' health coverage. These toolkits include a variety of resources, including flyers, posters, and email templates, again, just to make it easy to communicate programs and solutions to our members. I do have listed on this slide some of the available toolkits that we have. I do highlight some of these solutions that are highlighted on that placemat, such as cancer support and maternity and menopause. But I do also want to mention that there's other just more helpful resources out there as well, including open enrollment resources that help an employer maybe help educate a member regarding the difference of maybe a PPO plan and an HMO plan. So as they go into open enrollment, those types of information is important to share with members. There's also information just regarding using an online account. So helping a member better understand how to access their ID card online, how to find in-network providers, or even how to price out the cost of certain prescriptions and medical procedures. So again, just a way to educate customers and members about the resources available to them through Blue Cross. All right. So as I mentioned at the beginning, I do also want to provide a bit of information regarding some of the specialty benefits that Blue Cross offers, including dental and vision, because integration of specialty benefits really does provide value and enables employers to provide coverage that meets the whole health needs of their members. More specifically, when dental is integrated with medical, it can help to avoid higher medical costs. Vision coverage provides an opportunity for early detection of several serious health issues. And while I will not be covering them today because they were reviewed on the last webinar, Blue Cross does also offer financial protection options, which help members to cover unexpected expenses. First, we'll take a closer look at Blue Dental, which does offer members access to one of the largest PPO networks nationally. This is referred to as our Tier 1 network. Beyond that, Tier 2 provides access to participating dentists and gives members even more options for savings and choice in their dental care without balance billing, which is super important to point out. But between Tier 1 and Tier 2 providers, 93% of all claims dollars are paid to participating providers. This shows how expansive our dental network is. Blue Dental does have a variety of plan options available, including PPO Plus plans, which gives members access to any licensed dentist anywhere. PPO plans, which provide members with lower cost when they see PPO providers, so giving them an incentive to stay in network, as well as EPO plans, which require the use of a PPO provider. In Michigan alone, our PPO network includes almost 3,600 unique network dentists and over 130,000 in-network dentists nationally, ensuring members have access to coverage wherever they are located. So in addition to dental coverage, vision coverage is just as important to a member's overall health, as ensuring members have access to comprehensive eye exams is extremely important. Comprehensive eye exams can spot signs of at least 30 serious health issues, including diabetes, glaucoma, high cholesterol, hepatitis, and other infections. Blue Vision with VSP offers broad access and deep discounts that makes getting care easier for members. Members have access to more than 1,300 unique providers in Michigan and over 35,000 providers nationwide. And while I won't be going into extreme detail today on the quoting process for dental and vision, I do recognize that we are coming up on crazy fourth quarter. So hopefully you guys will be quoting some dental and vision for your groups. I'd love to see more of them come over, but I did at least want to provide just this brief overview of how you can obtain quotes for dental and vision coverage. How you obtain the quote can vary by group size or rating type. So if you are unsure of how to get a quote, reach out to the SBAM team or one of your Blue Cross contacts, and we can definitely point you in the right direction. And then finally, I did not go through specific details on the specific dental and vision plans that we offer, but I did want to mention that those plan menus are located within Agent Secured Services or the Agent Portal. If you are a licensed Blue Cross agent today, it's likely that you're very familiar with Agent Secured Services, or we will be launching a new agent portal later this summer, but that really is your one-stop shop to servicing Blue Cross customers. It gives you access to your book of business, as well as product information and commission information. But again, we do have a new agent portal launching this summer that will make it even easier for you to service your Blue groups. And with that, I thank you for your time today and your partnership. I hope the information that myself and Nicole Sherwood have shared on these webinars highlighted the difference of Blue and all of the ways in which we are working to help control cost and ensure members have access to convenient, affordable care options that help them better manage their health. Thank you.
Thank you, Sarah. So I also dropped in our URL for the SBAM agent portion of our website. Our member care team is here to serve you and your customers. So please reach out to us if you have any questions at all. Thank you all for your time. Thank you, Brian, Winston, Sarah. I hope everybody has a great afternoon, and please don't hesitate to reach out if you have any questions at all. Have a great day.